I'm going to show you the top 5 exercises to help relieve sciatica symptoms. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine doctor currently practicing in the San Francisco Bay Area, and over the years treating countless patients with back pain and sciatica, I've seen firsthand just how frustrating and debilitating this condition can be. But I've also seen how quickly a simple and targeted exercise program can ease symptoms and restore function. These 5 exercises are designed to do exactly that, to help you move with less pain and get you back to your daily activities. The first exercise is the lying figure 4 stretch. To perform this, lie on your back with your knees bent and your feet flat on the floor. Cross one ankle over the opposite knee so that your legs form the shape of the number 4. From here, gently bring the uncrossed leg toward your chest by grabbing behind the thigh and pulling it closer. You should feel a deep stretch in the glute and outer hip of the leg that's crossed. Hold this position for 20 to 30 seconds before switching sides, and then repeat 2 to 3 times on each side. The figure 4 stretch is important because it directly targets the piriformis muscle and the deep glutes. In many people, the sciatic nerve runs right underneath, or in some cases even through the piriformis. And when that muscle becomes tight or irritated, it can compress the nerve and cause pain that radiates down the leg. And so by lengthening the piriformis and surrounding gluteal muscles, the figure 4 stretch helps reduce pressure on the sciatic nerve, it improves hip mobility, and decreases compensatory strain on the lower back. And together, these effects can significantly relieve sciatica pain and restore more comfortable movement. The second exercise is the seated hamstring stretch. Sit tall on the edge of a chair or on the floor with one leg extended straight out in front of you and the other bent for support. Keep your back straight and slowly hinge forward at the hips, reaching toward your toes on the extended leg. Avoid rounding your spine. Focus on leaning until you feel a gentle stretch along the back of your thigh. Hold this position for 20 to 30 seconds and then switch sides and repeat 2 to 3 times. This stretch is valuable because tight hamstrings often pull on the pelvis, increasing strain on the lower back and worsening sciatic symptoms. And so by loosening the hamstrings, you reduce that excess tension and allow for better alignment of the spine during movement. In terms of body mechanics, lengthening the hamstring eases posterior pelvic tilt and decreases stress on the lumbar discs and surrounding nerves. This not only helps calm irritation of the sciatic nerve, but also improves flexibility in the hips and legs, making everyday movements like walking, bending, and sitting much more comfortable. The next exercise is the knee to chest stretch. To perform it, lie on your back with your knees bent and feet flat on the floor. Bring one knee up toward your chest, holding it with both hands just below the knee. Gently pull the leg closer until you feel a comfortable stretch in your lower back and hip. Keep the other leg relaxed on the ground. Hold this position for 20 to 30 seconds, and then switch sides and repeat 2 to 3 times on each leg. This stretch helps reduce tension in the lower back and gluteal muscles. These are areas that commonly tighten up in people with sciatica. By drawing the knee toward your chest, you open up the space in the lumbar spine and gently stretch the muscles around it. The way this works is by easing pressure on the lumbar discs and improving spinal flexibility, which can reduce irritation of the sciatic nerve. It also promotes better mobility in the hips, as well as the pelvis, making it easier to move comfortably throughout the day. The next exercise is the glute hip bridge. Start by lying on your back with your knees bent and feet flat on the floor, about hip width apart. Keep your arms relaxed at your sides with your palms facing down. Now from this position, press through your heels and slowly lift your hips toward the ceiling until your body forms a straight line from your shoulders to your knees. Hold the top position for 2 to 3 seconds, then lower your hips back down with control. Aim for 10 to 15 repetitions, repeating for 2 to 3 sets. The glute hip bridge is important because it strengthens the gluteal muscles, which play a critical role in stabilizing the hips and supporting the lower back. Weak or underactive glutes often force the lower back and hamstrings to take on more stress, and this can aggravate sciatica symptoms. Functionally, the glute bridge helps by improving hip extension strength and reduces strain on the lumbar spine, which then promotes better posture during movement. Stronger glutes also reduce compensatory patterns that can irritate the sciatic nerve, making this exercise a very effective way to both relieve symptoms and prevent flare-ups. The final exercise is the bird dog. Begin on your hands and knees in a tabletop position with your wrists under your shoulders and your knees under your hips. Engage your core, then slowly extend one arm straight out in front of you while extending the opposite leg straight back behind you. Keep your hips level and your back flat. Avoid letting your lower back sag or your body to rotate. Hold for a few seconds, then return to the starting position and switch sides. Perform 8 to 10 repetitions on each side for 2 to 3 sets. This exercise is especially valuable because it builds core stability while strengthening both the lower back and glute muscles. A stable core provides better support for the spine, which helps reduce excessive movement and irritation around the sciatic nerve. On a mechanical level, the bird dog promotes coordinated activation of the spinal stabilizers, the glutes, and the shoulder muscles, and this helps train them to work together to protect the lower back. And over time, this not only relieves sciatica symptoms, but also enhances balance and control during everyday activities. These exercises should be done daily for the best results, but to really maximize your recovery, you'll want to add in other stretches that target the spine and surrounding muscles. The key is knowing which stretches actually help. So in my next video, I'll walk you through the safest, most effective back stretches to relieve tension, improve flexibility, and protect your back long term.